My name is Dr. Simon Kadu, and I am the acting district health officer of Ntoroko district. Ntoroko district today joins the world to celebrate the Global Week of Action for the survival of our children under 5. Ntoroko is one of the new districts in the country, just about 2 years. It's also an under 5 district. As a district, we are committed to ensuring that children under 5 can survive, and we have done this through a number of ways. Despite all that, we still have some we lose. Many of the causes: malaria, pneumonia, diarrhea, and complications which result from those, especially when there are delays in getting treatment. Yes. These days are preventable. Malaria still is responsible for many of the deaths that occur in children among under 5. Respiratory tract infection and diarrheal diseases, those are among the most common causes of death. It is also, we are also seeing some deaths due to HIV and AIDS and the opportunistic infections that result. What can be done is multidimensional, and as I've mentioned, preventive is the best to prevent those diseases from taking place. Of course, going for effective immunization, and of course where we can't reach, maybe making outreach in those areas, but also when most of those things are getting early treatment at community level. That community level prevention, and I will repeat, prevention at household level and treatment at household level. That helps us such that we don't get very complicated.
Esther Kaho.
Esther Kaho ikaranka.
Masaka.
Ikara Masaka. Amabaraga omwana.
Edson Mugisa. Omwana kamuzara kurungi. Yamara ibiro bena nyamutwara mwadoro. Tokitegambe omwana kwa solo tetanus. Twandikire baro tumutwara toro. Makumutwara toro bamujanja. Yamazire biro bibiri toro tanga kuzimba engoma. Engoma nezi. Bamutahe mubazi engoma nezi. Bamutahe mubazi kutumira balinda baturaga. Twarugaye. Marugaye bangera bangama ngarukenya ariko medical. Numisiko kabanya kabantu sabisana. Yale mutwara medical. Tuko na bale bagamba mwana mutwara kembali.
Pamutwarayo?
Mutwarayo.
Awaki.
Sete zikabura. Ebibe mwana bura tingabizibuki.
Yati ubaire noenda bakoreki umuntu yena.
Kwa kumbu biyambi. Biyambi ni mbwetanga kandi.
Biyambi kiburi kwenda.
Biyambi. Biyambi mbwetanga no kujanjagwa.
Kodingwar Elna. I live in Kahumbu one village, Kasitu Paris, Kasitu sub-county. I have lost my child, Wambal Musike. That child died on November 2011. He died with HIV/AIDS. The problem is we never tested him. Just after getting malaria, I goes to hospital. The health workers tested that child. He told me that the child has an HIV/AIDS. After that, my child got lost. So the government should help me in everything, like money. And in our village, we are hard to reach area. We don't have roads. The government should help us to give us roads. Even the health workers, the health centers is very far in our village. So even the problem is we still have another problem of RVs, because the health workers is very far. If we tell a patient to go there, they refuse. That is the problem we have in our village. The government should help us to give us health centers.
I'm called Maska Eva. I stayed in Masoli Training Center. I'm a volunteer. Volunteer here in Special Training Center 3. The main problem concerning about malaria or child sickness is malaria actually. Okay. Like a good example, I lost my son called Baruko Sadab. So that's why I'm saying that malaria is too high in this area. I don't know whether we are lacking a lot of nets and a lot of drugs. And maybe being on longer distances, other than from hills, from far, and being poverty, it can make child to get off from the world. We want some drugs, a lot of drugs. We have few drugs. Whenever it gets off, it takes a long time to bring drugs here at the health center. We want enough staff. We are supposed to get 16 staff, but now we have 8. Okay. And admissions. Some ward like ward of a chair of infant, pediatrics, and the mothers. That I wish if there is some ward here, my kid I wouldn't just borrow money from other places or from somebody to take my child to the hospital, because when we were having some wards here and there's enough drugs, I think in my mind I was suspecting that my child wouldn't go. We don't have ward here, we don't have drugs here. Whenever you come here, they just told us we don't admit, because the center is still the health center 3. Don't have ward, don't have beds.